Welcome everyone. It's been a few weeks and everybody's enjoying their summer, I hope. I am so happy to have Hadas Abouaf join us today, and she's going to be talking about managing your medicines. And while I'm looking for her bio, I just want to tell you real quickly how we met because it's one of the small world stories. I spoke to a group about 4 or 5 months ago at Sunrise. It was a group of caregivers, care providers for seniors. And one of the things I was talking about was the fact that people who go in the hospital don't get their medications on time. And I had stress, you have to be firm about, you have to have your medication on time every time. And she came up to me afterwards and she said, I'm so glad you said something about that. That's the biggest problem we have. And then we go on to, we start talking, and it turns out that her mother-in-law was a docent with me at the same museum for 25 years. So I know her mother-in-law quite well. So it's just, a small world. Everybody gets to know each other quickly. So let me find her bio real quick, and I'll tell you a little bit about her. And there it is. Okay, so Hadas is a registered nurse who began her career in nursing over 25 years ago on a pre- and post-transplant unit at Children's Hospital, Los Angeles. While working, she went back to school and fulfilled the requirements for a gerontology certificate and graduated from CSULA. I got my master's there too. Cal State University, Los Angeles. After 7 years of working in the hospital, she began CareNet LA, a family-run home care agency with a vision to care for clients as she would want to be cared for. While working in home care, she saw a need for improved medication management for her clients. Clients were mixing over-the-counter medications with prescription medications. They often had multiple prescribers who didn't know about one another and used multiple pharmacies. So to fill the gap that was so evident with her clients, she formed Med Divide Nursing, a nurse-based company qualified to sort and organize medications prescribed by physicians. Med Divide bridges the gap between what happens at the doctor's office and what actually happens at home. So just as an example, and I'm sure you all have your own cocktail, and I hope you can see this, all the different medications. It's hard to see because I have the screen on the background, but you can see I'm taking a lot of different medications. And I take, in the morning, I must take 10 or 12 pills. Some of them are supplements, some of them are prescription medicines. And I said to her, should I be taking all of these at the same time? Are they having a party in my stomach? What's going on? Are they interacting? So she's going to talk about all these things. So I'm going to turn it over to her. I'm going to stop my slide share, and Hadas, it's all yours.
Thank you for having me. Thank you so much for your patience, and thank you, Sharon, for the introduction. So as Sharon introduced, I'm a registered nurse, and I've been doing this particular business. I've had several businesses, but this particular business of caring for people with their medications, organizing medications, and making sure that there's a connection between what happens at home and what happens at the doctor's office. I've been doing this for 10 years. And one of my patients was Elaine, who I had a couple of years ago, and she had Parkinson's, pretty severe. She pretty advanced form or in her stage of Parkinson's. And I loved Elaine. Elaine was an interesting, funny, smart, and dedicated woman who had a lot of issues and needed to take a lot of medications. And I just fell in love with the whole process of Parkinson's because there were so many medications that were new to me, and she was taking 6 to 7 times a day medications, and I set them up for her for the month. So from that situation, I was just very interested in the process. And so here we are. We're going to be talking about today. Can you see my screen? Is this something that everybody can see?
Yeah.
Okay.
Everybody see it?
Okay.
Just wave your hand. Yeah, okay. Yeah, they're seeing it.
I'm not seeing everybody. So you're seeing everybody, and because my screen is a little bit screwed up, so it's fine. But here's the presentation overview. What is Parkinson's? We're going to be discussing the definition of Parkinson's, motor versus non-motor symptoms, dysautonomia, which I know that many, they kind of go hand in hand. Many people with Parkinson's suffer from a lot of autonomic nervous system misfunction or malfunctions, let's just say. We're going to go over the medications for motor symptoms. There are 5 groups plus rescue and then symptom control medications. Then we're going to talk about what we know about treatment, including exercise. We're going to talk about the gut-brain relationship, including diet. Then I'm going to give you some tricks and we'll talk about supplements. And then we're going to talk about medications and supplements to avoid. And then we're going to talk about traveling with Parkinson's. So we have a lot to cover, but I'd be happy to stay after if that's something that you would like to answer any questions that you might have. So Parkinson's defined. Parkinson's disease is the loss of brain cells in the midbrain, the substantia nigra, where dopamine is produced. It's a progressive neurodegenerative disease which affects the whole body, not just the brain. So kind of like the hallmark of Parkinson's are the medications or are the symptoms that we kind of see, the rigidity, the tremor, the slowness. Those are the things that people see, the motor movement problems. Then there are the problems that people don't see, which also is the autonomic nervous system, in addition to a few other things. The things that people don't see include constipation, speech, swallowing difficulties, lack of facial expressions, hypotension, which is often orthostatic hypotension, sleep problems, bladder problems, depression, anxiety, gastric reflux, and difficulty controlling our temperature, our internal temperatures, including dementia. We're not going to go over these 2 slides. Did you see, by the way, let me ask you, do you see this slide?
Treatments for dysautonomia symptoms.
Yeah. Okay. So we're not gonna talk about that unless that's something that we have time for. Those are the 2 slides that I blocked out because that's the dysautonomic syndrome, the things that you don't see, but we're going to focus right now on the motor symptoms. And it's not really allowing me to, okay, we'll see what we can do. The first line of medication is usually carbidopa. Levodopa is converted into dopamine in the brain. Carbidopa is a transporter of levodopa, and it gets absorbed in the small intestines. So once it gets transported to the small intestines, it passes through the blood-brain barrier, and then it converts into dopamine. And usually you take it 3 to 4 times a day on an empty stomach or a protein empty stomach. Usually 30 to 60 minutes after a meal with protein, or about 30 minutes before a meal with protein, because protein doesn't allow for the full absorption of dopamine into the system. Sinemet is the carbidopa-levodopa medication that usually people start with, 25 by 100 milligram tablets. And there's also the Sinemet that is dissolvable and extended release and controlled release. There are different types of medication of Sinemet or carbidopa-levodopa. The side effects, unfortunately, include nausea, lightheadedness, and hallucinations, and that's the effect of dopamine in the bloodstream. So what happens is when you're taking dopamine or levodopa, if you have it in your bloodstream, that's when you get the nausea and the lightheadedness and all of that stuff. If it gets absorbed through the blood-brain barrier quickly and fully, then you won't feel as many symptoms, which is why you don't want to have the protein. But unfortunately, nothing is complete, right? And so you will have some nausea and some of the hallucination and lightheadedness. As with all medications, we like to start small and titrate up. So usually people might start with a half a pill and then titrate up to a full pill, or titrate up to a higher dose. The second line of medications, and I'm sorry that it's like this, but when in my slideshow, the way that I organized it, things pop in and it's easier to digest all of this information because it's a lot of information. So, but the second group of medications that we're going to talk about are the dopamine agonists. So agonists activate neuroreceptors, whereas antagonists block neuroreceptors. So dopamine agonists are chemical agents. Sorry, I'm just moving my my view over here. They bind to the dopamine receptors and they trick the brain into thinking that it's receiving dopamine. So the brain is not really receiving dopamine. It's used as a dopamine kind of saving strategy so that you don't have to take as much levodopa, carbidopa. And the advantages are that not only does it lead to less likely to lead to dyskinesia, but it also treats depression. So dopamine agonists are very good. The disadvantages are that you may get some sudden sleepiness and loss of control over impulses, although that's very uncommon. Medications that are dopamine agonists might include pramipexole or ropinirole extended release, rotigotine, which is the patch. It's long acting, but it's a little bit more expensive probably. Then you have the apomorphine injections and the apomorphine sublingual film, which are more treatments for off periods. They're rescue treatments. So those are, we'll talk about rescue treatments a little bit later. Okay, so I have to go down this way. Monoamine oxidase B inhibitors are the next type. And monoamine oxidase is an enzyme that is involved in the normal dopamine recycling in the brain. So there's less in the brain when things get recycled. This inhibits the recycling of the dopamine, and so thereby increases the dopamine in the brain. It's mildly beneficial, but it's tolerated well, and it's usually used in combination with other medications. Selegiline, rasagiline, and sulfonamide are examples of monoamine oxidase B inhibitors, but you don't want to take them late in the day because they kind of exacerbate insomnia. So you want to take them earlier in the day so that you can sleep, because we know that sleep is really, really important. The next group of medications that we're going to talk about are COMT inhibitors. That's the catechol-O-methyltransferase. It is an enzyme that is involved in the breakdown of levodopa. So if you don't break it down, you have more in your brain or in your body. And it's only used in combination with carbilevo because these enzymes have no effects on their own. So if you take carbidopa levodopa tablets, entacapone or Comtan is available separately. That's the enzyme. That's the COMT inhibitors. Or it could be taken in combination with carbidopa levodopa in one pill, and that's called Stalevo. And the side effect may be diarrhea, which is, I guess, okay if you're having some serious constipation, which is one of the big problems in PD. But pills are also, another thing to know is the pills are orange and they can stain the counters, the hands, and your excrements. So don't be alarmed if you see your excrements bright orange. The next type of medication that we're going to talk about is adenosine A2A receptor antagonist. So remember, antagonists block. So adenosine can inhibit dopamine release in the brain. By blocking the adenosine, dopamine signaling is more likely to increase. So adenosine is it kind of is a sleepy, it's a sleepy kind of, I guess, receptor in your brain. And so it's opposite to caffeine. It's opposite to your fight flight. So another tip is that caffeine also blocks adenosine and it binds to the same nerve receptors in the brain. So in another explanation is adenosine and caffeine have opposite effects. They have sort of the same effect as the dopamine adrenaline fight flight effect in the brain. So as with any fight flight situation, when your body is worried about survival, right? When your body is in motion to get out of danger, everything goes to the important organs in our bodies. So our brain, our heart, our the limbs that we need to use to get the heck out of danger. And so everything else is kind of goes by the side to the side. And the side effects may include constipation, insomnia, dyskinesia. The only medication, but it keeps us awake and alert, which is what we want with Parkinson's, because adenosine will make us sleepy. So the only approved add-on medication is Nurians, and it has, like I said, similar effects to coffee, although Nurians you can take later on as well. Then then there are the rescue medications for off periods. So off periods are the times that you are feeling not completely like the medications are effective. You're slowing down. It's not time to take the next medications, but you're feeling like the medications are wearing off. So the medications to take, you can take stuff for that. You don't have to feel like you're slowing down so much. You can take an extra carbidopa levodopa tablet. You can take a partial tablet or a full tablet. It can be crushed or chewed. You can take it with a full glass of water or with a carbonated or acidic drink like orange juice, because that helps speed up the absorption of the tablet. And we're going to talk about that a little bit more in a minute. You can take levodopa inhalation, and that can be taken a couple of times a day. And then the dopamine agonists that we talked about, the injection, apomorphine injection, and the apomorphine sublingual film, which get absorbed very quickly. And those are great also for off periods. Okay, the next slide we're going to talk about are the symptom control treatments. So there are a couple of medications that control symptoms. Amantadine is the only medication used to treat dyskinesia, the uncontrollable movements. And you can have extended release, and there's a couple of types of extended release tablets. But the problem with amantadine is that for older folks who already have issues with dry eyes, dry mouth, it kind of exacerbates those symptoms, and increases constipation and hallucinations. But it does take care of dyskinesias. And then there's the anticholinergics, which also help, but they only help with tremors, not with stiffness or slowness. And they unfortunately have the same side effects as amantadine, with dry eyes, dry mouth, constipation, all of that stuff. And then there are the surgical therapies. Surgical therapies include the deep brain stimulation surgery and the Duopa pump, which constantly gives you the carbidopa levodopa. The unfortunate thing with these therapies, with the surgical therapies, and which is why it's not so much more popular, is that it doesn't, you can't really get off of all of your medications. You still need to take some medications. And in addition to that, it doesn't get you to a place that is better than the medications will take you. You're still going to be, so the best that you have now is the best that you're going to have with the surgical treatments. So most people prefer to just continue with the medications that they're taking because they have a little bit more control. What we know about treatment: exercise, as you know, is one of the best treatments. So Tai Chi, yoga, dancing, boxing, swimming, anything that you do to move promotes balance, coordination, flexibility, mobility, and strength. Also, it helps you with sleep, and it helps, increase your mood, improve your mood. So I know that you've spoken about those things, about exercise, in many other webinars before mine. So I'm not going to go into detail so much with the exercise, but just know that is your best line of defense, or the best way to help you maintain what you have. We know about the treatment that symptoms will still fluctuate, and you'll still have some off time where the medications wear off earlier than expected. That's part of this. That's part of Parkinson's. But there are ways to, like I said, to treat that. And fluctuations are generally treated by adding a dopamine agonist, changing a dopamine agonist from short acting to long acting, or adding the booster medication. And rescue medications are also very helpful. Now, food diversity definitely matters. I know you've spoken about diet as well. There is a gut-brain relationship. And when you're feeling inflamed and you have delayed emptying of your stomach, and when you're feeling more constipated, you're not feeling good, chances are there's a relationship there with something that you've eaten, and or anything that is going on with you. Eating more a variety of foods is definitely key, and it's super important with Parkinson's. A healthy microbiome is a diverse one. It affects the gut bacteria, your metabolism, your immune response, and your gut hormones. There are so many things that affect our microbiome, including what we eat, how often we exercise, where we live, your stress levels, your antibiotic and pharmaceutical drug intake. They all affect how we feel. But the best way to control that is with a diet that is rich in variety. And the Mediterranean diet is what is recommended. It encourages a lot of fruits and vegetables, nuts, seeds, good fatty foods like fatty fish, salmon, and nuts, and all of those things. They're very important and we'll go over that a little bit more when we talk about supplements. Things to know. Tricks and supplements to help. Take your medications with a full glass of water. It helps with lightheadedness, absorption, and it decreases constipation, which affects, I put here 70% of people with Parkinson's, but really I've seen statistics as high as almost 90%. So a full glass of water is very important with all of you, besides the fact that you don't want to be dehydrated anyway. So because of the constipation, take a full glass of water. It'll help with a lot of stuff. Acidic or calcium fortified orange juice or a carbonated drink will help to increase the absorption of carbidopa levodopa tablets. So if you, for example, and this is maybe to use on an off period, or when you're feeling a little bit slow, if you break a tablet of levodopa in half, you crush the tablet and mix that crushed tablet with orange juice, and then swallow the mixture, and then swallow the other half of the tablet, it can speed up the effect of the medication. I don't know if you knew that or not, but it's a good tip. Protein, as we said, should not be eaten 60 minutes to 30 minutes after the medication. 30 minutes before or 60 minutes before or 30 minutes after the medication has been taken, because the absorption is not complete. The proteins and the levodopa compete for the same absorption pathway. So if you're eating protein at the same time, the protein will get absorbed, or some of the protein, some of the levodopa, but not all of the levodopa, which is why it's important to stay away from protein. Your last meal of the day should have the highest protein level, but that is not to say that you shouldn't have proteins throughout the day, because the last meal of the day is not going to give you enough protein. So during the day, between medication intakes, take small quantities of protein. You can have walnuts, cashews, or other nuts that can promote brain health and give you the good fats that your brain needs. And then if you include some berries with it, you have these antioxidants, and it's a beautiful snack that you can have in between meds. You can also have whole wheat bread, and with a slice of cheese, that's fine too. Crackers, bread, bagels, fruit, or foods that are high in carbohydrates and low in protein are okay to eat with your medications, and they may reduce nausea and hypotension. So don't eat a whole lot of these things right when you're taking your foods, because that will slow down the absorption as well. But if you have a few crackers, a slice of bread, a half a bagel, or some fruit, you're going to feel better. You're not going to have as much nausea or hypotension, orthostatic hypotension, as you would if you didn't. Nutrients such as caffeine, we already talked about it, and chocolate may play an important role in postponing and improving symptoms of Parkinson's because they bind to the same neurotransmitter receptors as adenosine, which is a depressant. So if you're taking, so basically what I'm saying is, don't feel guilty about having that piece of chocolate. Enjoy your chocolate and enjoy your coffee. It's okay to have when because it might make you feel better anyway. Dietary requirements and supplements. Eat a balanced diet because the whole system has slowed down or is slowing down with Parkinson's. You're not eating as much of the even the good food necessarily that you're supposed to eat. So whatever you put in your mouth is very important. So reduce the sugar and the salt and the saturated fat and eat healthier foods. Eat the whole wheat, eat the nuts, eat the seeds and the whole foods. I've seen some case studies and I can't verify 100% that they are correct, but you know, sometimes it's an interesting thing that I saw that fresh foods are associated with reduced symptoms of Parkinson's, while canned fruits and vegetables are associated with a more rapid progression of Parkinson's. And low-fat dairy products increase symptoms of Parkinson's, while full-fat reduce the symptoms. I can't verify that this is 100% correct, but I have seen some studies, and I think that, you know, why not?
Lori Mishley has talked about not eating canned food if you
Yes.
staying away from it if you possibly can.
Stay away from processed, stay away from canned foods, stay away from, if you can have the full fat, have the full fat. Why not? It's good for you. But exercise, obviously. Okay, supplements. Now we're going to talk about supplements. Supplements should only be taken under doctor's orders. Don't take supplements without running it by your doctors because those are medications too, and they can definitely influence the absorption of your medications. I put here in yellow, and you'll see in the next slides also, there's some in yellow and some in orange. The yellow ones are probably okay to take as supplements. The orange ones are probably, you can get them from food, and it's better to get them. So calcium. Okay. Calcium is the most abundant mineral in the body. If you don't get enough in your diet, your body will start leaching it from your bones, and that will increase your risk of osteoporosis. It's really important with calcium because calcium is very important for the body to work properly. It's involved in muscle contraction, nerve signal transmission, hormone release, blood vessel function, and blood clotting. It's really, really important to have enough calcium in your body. And because calcium, you get it from dairy foods, which have protein, likelihood is that people with Parkinson's might have a deficiency in calcium. So it is something that you should notice and pay attention to. Chewable calcium citrate is often better than other calcium supplements because you start chewing it and it starts getting metabolized in your saliva and in your mouth, and by the time it gets to your stomach, it's ready for absorption. So calcium citrate chewable, that's the best thing for Parkinson's. Vitamin D is absolutely necessary because the body can't absorb calcium without adequate amounts of vitamin D. So a deficiency is common also with people with Parkinson's, maybe because I'm not quite sure why it's more. Maybe it's just it's not absorbed as well, or because of the types of food, because it is something that that comes in fortified milk, margarine, and cereals, fatty fish, liver, and eggs. And it's important for regulating dopaminergic neurons. So it may slow down the progression of Parkinson's if you have enough vitamin D. You may not see it. You don't know how fast you would progress without it, but it's important for you to have in your system. So calcium and vitamin D. The next one is vitamin E. And the thing that you'll see is that a lot of the foods that I'm showing here are common foods for a lot of these vitamins. Vitamin E and vitamin C are both in orange because you shouldn't probably take those as supplements. Vitamin E is a fat-soluble vitamin. So fat solubles get out of your system slower. So it's not necessary to have as much. It improves brain activity. It reduces the effects of Parkinson's deterioration. The foods include sunflower oil and seeds, almonds, peanuts, asparagus, and avocado. Best to get those in your diet. Vitamin C is also really important. It's an antioxidant, which is beneficial to controlling Parkinson's by getting rid of free radicals. It's present in many, many fruits and vegetables, including citrus fruits, strawberries, tomatoes, broccoli, and white potatoes. Coenzyme CoQ10 promotes brain function. So that's in yellow. And those are two that I suggest taking after running it through your doctor if you're not taking them already. It can help. CoQ10 helps neutralize free radical damage and promotes better mental acuity and energy levels. So the foods also include oily fish, organ meats, and whole grains, which are generally fortified. And then omega-3 fats, if you're not taking them, they're super important. Help the brain by preventing inflammation, supporting neuron growth and health, reducing the production of oxidant species, and you want the antioxidants to clean those up. And they help the body process calcium. So a deficiency in these can make it harder for the brain to tolerate the free radicals that are in your brain and can cause some brain cell damage. The foods include flaxseed, chia seeds, walnuts, and fatty fish like salmon. So a lot of these you'll see, like I said, they're similar foods for the same vitamins. If you have questions, and I'll answer those in afterwards. B vitamins are also something that you may want to consult with your doctor about taking. They're really important for memory and coordination, but they usually come from protein sources. So that's why B vitamins shouldn't be taken at the same time. People with Parkinson's generally have a higher risk of deficiency in B6 and B12. B6 vitamins reduce the effectiveness of levodopa, and they shouldn't be taken at the same time. Like I said, protein sources, beef, clams, tuna, nutritional yeast, eggs, dairy products, and fortified breakfast cereals. And then B12, which, vegetarians who are young might need to take B12 because you can't get these vitamins from your diet if you're not having protein, animal protein. And a lot of people are taking B12 injections because the body absorbs the B12 injections much better. So that's a very good source of B vitamins. And then whey protein, that's a protein source to increase your protein during the day. You can have a shake or something later on in the day, may help increase antioxidants. So when your lower body functions are reduced, more protein, whey protein, and specifically helps retain that muscle mass in your lower body. And for nausea, ginger is an excellent source of nausea reduction. If you're feeling nauseous from your medications and you take a ginger slice and you put it into water, you boil it, and then you simmer it for 30 minutes, the liquid that comes out of it will be so helpful with nausea. You can put it in your drinks. You can put it even with your orange juice when you're taking your Carbi-Levo, and that might help with absorption and with decreased nausea. And if you have small crystallized ginger pieces, chewing on those might help also with nausea. Medications to avoid. I'm kind of trying to go fast because I know that we're running out of time, and I want to leave time for questions. So medications to avoid are typical antipsychotics. They block dopamine receptors in the brain, which can worsen the symptoms. They include chlorpromazine, fluphenazine, Haldol, loxapine. I'm giving you a list of medications that is completely not complete. The full list you can find on the Parkinson's Foundation website. I'm just letting you know that on the Parkinson's Foundation website, there are a lot of medication lists that you can see that you shouldn't have with Parkinson, that you shouldn't have if you have Parkinson's disease. Anesthesia and pain medications to avoid include Demerol, Tramadol, Methadone, chlorbenzepine, and more. They don't mix with MAO-B inhibitors, monoamine oxidase B inhibitors. And especially when you're traveling, and I'll give you some tips on that as well. You should know which medications you shouldn't be taking with the medications that you have. Antiemetics for nausea and vomiting. They block dopamine receptors in the brain, and so you shouldn't have compazine, droperidol, Reglan, promethazine, or Zyprexa. And then the complete list again is on the Parkinson's Foundation website. I have another one right here that I didn't want to go through, but supplements to avoid. The supplements to avoid are the supplements that I already listed, because most of the supplements, most of the vitamins that you should have in your diet, or in your body, you can get from your diet. The FDA is not as strict on supplements as it is on regular medications. And so you have to beware of taking supplements, because your body is already going through a lot, and it's processing and metabolizing a lot of medications as it is. So you want to limit what you take, but definitely always consult with your doctor. Vitamins that I would say to avoid are the vitamins that I've already said. C and E, although they're necessary, they're super necessary. They're easily acquired through the diet. Your body absorbs them well, and they can be toxic to the brain cells if you take too much. You really can't take too much from your diet. So that's, just eat your normal food, and that's fine. Vitamin B6 interacts with carbidopa and levodopa, but it doesn't affect the combination of both of the medications together, Sinemet. But avoid the B6 supplements if you're taking levodopa on its own. And then iron, a lot of people are deficient in iron, me included. And so supplements can bind with levodopa and reduce the amount of medication that is absorbed. So if you have to take iron, leave at least 2 hours between taking the supplement and the levodopa. It's okay to take it, just maybe take it in the evening instead of in the morning. The next slide is travel. So I heard a lot about people who are, there's so much to know when you're traveling with Parkinson's. There's so much to worry about. There's a lot of schlepping that can be involved in traveling. So here's my suggestion. Before you travel, check with your movement specialist, MDS, and your Parkinson's doctor. Movement disorder specialist is what I wanted to say. Make sure you have all of the medications that you need for the length of your travel, plus a little bit of extra, because you never know, maybe a flight will be delayed and you're stuck in the airport for longer. Always keep your medications in your original bottles. Ask for an extra prescription from your doctor before you travel in case you need to fill the prescription wherever you are. All the medications should be with your carry-on bag. Don't pack them in your suitcase. The limit for the one carry-on per bag, a bag per traveler, it doesn't apply to people, to medical supplies or to assistive devices. So you don't need to worry about, you can take a backpack plus a bag for your medications and some assistive devices. They can't stop you from taking your medications on the plane. And then when you get to your destination, try to rest as much as possible, because you're already worn out and you may be anxious, and you may be your medications may be off on the schedule a little bit. So and all of those exacerbate the symptoms. So the first day of travel, just rest. When you're booking a flight, notify the airline that you have Parkinson's disease and let them know that you have some mobility issues. Then you can request a wheelchair or a wagon or whatever it is that you need at that time. Make sure your medical insurance policy will cover you wherever you travel, because that's really important. Check in early request an aisle seat near the bathroom and ask for help from the flight attendant, because if you need to go to the bathroom, you don't necessarily want to stand there in line behind all the people, and the flight attendant can make sure that you get in next if you need to go to the bathroom. During the flight, take frequent walks or exercise breaks whenever it's possible. Wear comfortable clothing, and if you need the pressure device, the TED hose, which are for to help you with your hypotension, wear those. Drink lots of water on the plane, and keep some snacks with you. Okay. And then the next one is set alarms on your phone or watch in order to keep the same intervals of medication intake while traveling. It's really important that you keep the same medication intervals. You may take fewer medications or more medications, an extra dose or one less dose, depending on where you travel and what the time schedule is. But you want to keep the same intervals. And then the next day, after you've arrived to your destination, keep the same intervals as well. So get on the schedule of where you are, but keep the same intervals. Use your medical ID tool on your smartphone if you're traveling, especially in the US, so that first responders can access the information about you. And again, there are tips on the Parkinson's Foundation for traveling, and those are important. Print out some hospital safety forms. This is super important. Sometimes they're known as the Aware and Care Kit, and they're also available on the Parkinson's Foundation site. They include the medical alert form. That's for your emergency contact information, who to call, where to be, where you need to be in terms of if you need to be in a hospital, what you need. Medication form, including the med regimen, your doctor's name and contact information. Because your medications may change, you need to make sure that that's updated anytime things are updated on your list. Your PD care summary for health professionals. Just because they're health professionals at the hospital doesn't mean that they know about Parkinson's. So there's a form that explains the medication regimen for people with Parkinson's for healthcare professionals, so that they can get up to speed with what you have to deal with. A doctor's letter is important because it highlights if you have an infection and you get hospitalized, it highlights the importance of your med schedule. So print that out as well. And then any other information that is specific to your own individual care needs. All of those are important. So it's a few forms that you need to bring with you, but they're very important to keep. And then enjoy your travels. So that is the presentation. I have I have some time. So if you need to ask questions, please do. And if you want me to, if this was helpful to you and you would like more information about other things, I'd be happy to come back. So take it away, Sharon.
Okay, what I'm going to do, let's stop screen sharing for right now. I'm going to show my slides. One of the main questions, the questions that came up several times is, can we get copies of the slides?
I will send the slides to Sharon.
Sydney asked, since she's having ankle surgery, Sydney, I think that this is something you need to talk to with your doctor, and you'll probably be in physical therapy, which will help you get to back to normal after surgery. Marjorie mentioned that orange juice is bad for diabetes unless blood sugar is low. So
it is. You don't have to take it with the orange juice. You can take it with carbonated drinks too. Just soda water is also helpful with absorption.
Okay. Regarding whey, Dr. Mishley told me to avoid dairy. I know she recommends no dairy. I eat a lot of dairy and I'm fine. So
yeah,
I think you just have to know what works for you.
You have to know what works for you. Everybody, everybody has their own situation, and not everybody is the same, of course. Make sure to supplement your calcium intake. Make sure that if you don't have dairy, that's fine. I mean, it's not something that you have to have. Find other ways to find out other protein sources.
Okay. I have a question. First of all, thank you. This was amazing. Hadas. I think that everybody got a lot out of it, and it was really wonderful. Okay. So as far as my slides were concerned, first of all, it was a thank you. We have next month, we have we're going to be talking about care. It'll be geared towards care partners. Dr. Jory Fleischer from Chicago, from Rush Hospital in Chicago, will be speaking to us about a study they're doing with care partners. So if you have a caregiver, care partner, this would be a wonderful opportunity for them to join you on a Sunday morning. And that is, I think, September 15th or something. I can't remember the date. And then in October 6th, Bunny Dibness will be speaking about elder care. She's an elder care specialist, and she will be talking about housing and, you know, different types of housing possibilities, independent, assisted living, et cetera, caregiving, all kinds of things, all the questions you really need to get answered before you move out of your home, or you want to stay in your home with a caregiver. And let's see what else. We have 2 support groups going on. We have our Tuesday morning Anything Goes group, and then Sunday morning is for singles, people without care partners, and we usually meet before our regular meetings, so that's an hour earlier. And I think that's pretty much it on my end. Oh, have there been any studies on the effects of over medication? Is that what you're asking, Farrell?
Over medication.
Over and how much flax meal per day is recommended?
Oh, flaxseed.
Yeah.
Well, I mean, I know that about 3 tablespoons is 1 serving of flax seeds. I like having, I have flax seeds and hemp seeds with my yogurt every day. I enjoy having that, you know, for breakfast, and that's what I have. It's just it's an extra way to get protein. Both hemp seeds and flax seeds are great for protein and for fatty fatty vitamins, supplements, omega-3s and all of that. And so that's what I have. And it gives.
Is it okay? And I can put that in my smoothie in the morning if I wanted to.
Yeah, you can. Now,
Okay.
the protein source, I don't know if it's the same, if the breakdown from those things is the same as the breakdown from the protein from animal products. So plant product proteins, I'm not sure if they digest the same. That is a good question for your MDS. Or I can look it up and let you know if you give me a couple of minutes. But yes, you can have it with your protein. If not at the beginning of the day, certainly towards the end of the day.
Okay. Let's see. We have a question on determining the amount of these supplements to take and best sources or brands. And even though margarine has vitamin E, does it cause inflammation from the hydrogenation process?
I don't know the answer to that. I don't.
Okay. Rytary, you didn't mention, but it's, you know anything about Rytary, the drug?
I
the
mean,
CL?
there are lots of different medications. I didn't go over all of the medications. I went through some of the types of the medications. And
Yeah.
Rytary is a very good medication, it sounds to me like, right? I'm not sure how many people are taking it. It's you would probably know a lot more about it than I do. But that's, you know, everybody's treatment is individual with this, and if it's helpful to you, that's great.
Okay. All right. Teresa's looking at bilateral knee replacement. Any advice for surgery other than making sure they give you your medications while you're in the hospital?
Yeah, keep your alarm on. Keep your own alarm on your phone, and make sure that it's 15 minutes before you need to take your medication, so that, and have a discussion with your nurse every day at the beginning of shift. Your nurse should be coming in and introducing him or herself. have a discussion. Say, I have Parkinson's. With Parkinson's, the medication needs to be given at the same time every day, because otherwise I feel the off effects. Every nurse has learned about Parkinson's, and they should know that it's really important. Have them prioritize your times, on their schedule. So have a discussion with your nurse every day and every night, if you need.
Do you
Okay.
have any suggestion for siluria or excessive salivation?
Oh, yeah. So,
My friend, my classmate, she has developed Parkinson's from Lewy body dementia, and she has so much excessive salivation, and because of Parkinson's, she's not able to swallow very well either.
right.
So,
Unfortunately, there aren't a whole lot. There are some medications that might decrease the salivary glands, but they also dry out your eyes, and they also cause constipation and all of that. So unfortunately, there isn't a great solution for that. It's one of those symptoms. I have in my slides, and I'm not going to share my slides right now, but in my slides I have the 2 pages, and I'll give them to you also when I send the when I share my slides with Sharon, because sorry about that. Because there are some tips there that I have for the autonomic nervous system, dysfunction, and that's part of dysautonomia.
Okay. All right. One last question, and then I'm going to go to, there's a couple that that are going to be live. Does ginger lower your blood pressure?
I'm sorry, say that again.
Does ginger lower your blood pressure?
I haven't heard that. Have you heard that?
no,
I haven't.
it's
Okay.
anti-inflammatory.
It's what?
Okay.
Anti-inflammatory, that's what they say in India.
Right.
Yeah.
It's an anti-inflammatory, but it doesn't
And also
appear
like,
that it lowers your blood
somewhat
pressure.
like anticoagulant.
Okay.
Yeah.
Okay. Dawn,
Just
all
to
right,
answer
Dawn has her hand up. So let's just start it. I'm going to start with the people with their hands up. Dawn,
Yes,
and then
thank you,
Deborah.
Sharon. Yeah, I think my sound is on, yes?
Yes.
Yes. Okay, so my question is this. I take almost no supplements, but I've listened to a lot of webinars that say you should take certain supplements. And I had the question on how do you determine the amount you should be taking and also where to get them? Do you just go to Amazon? Do you just go to Costco? Do you ask your friends? I mean, how do you know?
Start with your doctor. I would say, thank you for the question. I'll say start with your doctor, get a blood test, see how you're doing with your blood levels of your of all of your blood levels, and see what your symptoms are, and your doctor needs to be the one who encourages you to take these supplements. Really, most likely you can get them from Amazon. They're cheaper, or from Costco, they're cheaper. There isn't one brand necessarily that is much better than other brands for a lot of these supplements. Vitamin D, you can get, over the counter. Vitamin, calcium, as long as it's calcium citrate that you chew, that's the type to get, but you can get it from anywhere. There are a gazillion manufacturers for these things. Get this simple stuff.
Yep.
Don't worry
And the
about
same would hold true for like the omega fatty acids. They're all, one is just as good as another.
I mean, if you look on Consumer Reports, it might tell you the best brands to have, but there isn't so much daylight between the ones that they say that you should have and the ones that they don't recommend. They're all pretty good out there.
Thank you. Thank you.
Okay. Okay. Deborah Doxey, you had your hand raised.
Can you hear me, Sharon?
A little bit louder, Deborah.
Okay, yeah, I just wanted to let you know that I'm in California, those of you who don't know, and we're near USC, and they have another diet that we just heard about earlier this year from Dr. Petzinger at USC called the Mind Diet. It's a little nicer than the other.
It's probably similar to the Mediterranean diet.
Right, it is. I think it's
Which
just
is
more loose.
I
you
think
know.
it's a variation of the Mediterranean diet.
Yeah.
I don't remember what the difference is. I could look it
And
up.
just to get back to the plant-based proteins versus the animal proteins,
Mhm.
it says that the plant-based proteins are generally less digestible than the animal proteins, but they have different amino acid profiles, whatever. They're not digested the same way. So it may be okay for you, and that's something that you should ask your doctor, to take the protein in the morning from plant-based proteins like chia seeds and like hemp seeds. It may be okay for you because they're metabolized differently to take those in the morning as well.
Mhm.
That's a question that I would ask.
So, I
Okay.
mean, there's variation, so,
Okay. All right, Joan Hayes, you need to unmute yourself, and then somebody, I think, who else had their hand up? Janie, did you? Okay, Joan and then Janie. We have two Janies.
Can you hear me
Okay,
now?
yes.
When you're taking a number of medications, should the tendency is to take them all at the same time? Is it better to space them out?
Your vitamins you can take at the same time. The difference is which medications are you taking? I mean, if you're only taking the Parkinson's medications, which chances are you're not only taking your Parkinson's medications, because there's so many you know, symptoms that happen with Parkinson's, and there may be morbidity, you know, symptoms. You may have Parkinson's and something else that you need to take medications for, like heart disease or you know, for breathing, or for, you know, whatever it is that you might have, diabetes or anything else. Yes, there are some, you do need to check the spacing between your medications, but that's something that that would require looking at your whole medication list and letting you know which ones should be taken in the morning and which ones should be taken at night. That's something that I can do, but also that's something that your doctor can do. So when the next time, if that is something that you really want to know, then set up a longer appointment with your doctor. You can let them know that this is a medication evaluation appointment that you need, like a new patient, a little bit more time for. And so it may require, you know, an appointment for a later date, where you bring in all of your medications, or you have your full medication list, including all the supplements and all the medications that you take for all of everything that you do in the day, and let your doctor go one by one. Even email the doctor in advance all of your medications. That would even be better, so that when you're in there, the doctor can discuss with you which medications should be taken in the morning and which medications you should leave for the night.
Okay. Janie Gillette, I think you had your hand up.
Did that answer your question?
Well, I know which medications are for morning and night, but for example, if I have 3 medications in the morning, should I?
Yeah, you can take them all at the same time. It's assuming that you can take them. There is an assumption that many medications can be taken at the same time. And if they're recommended all for the morning, there's an assumption, if they're all prescription medications, that they can be taken at the same time. The pharmacy would tell you, well, supposedly would tell you otherwise. If you have a question between the specific 3 medications, that's a question for your doctor or your pharmacist. Your doctor or your pharmacist can go over those with you. But yes, there is an assumption that you can take a bunch of medications at the same time.
Okay, thank you.
Yes, and your body can.
Now, Janie.
Sorry.
Hi, thank you very much. I was wondering about probiotics. Is there any?
Yeah, I mean, so
Take notes.
natural, yeah, so it's great for your microbiome. right? Probiotics help you with your microbiome. But generally you want to get them from your diet. If you want to get probiotics as an additional supplement, ask your doctor about it.
Okay,
Yeah.
thank you.
It is something that could be very helpful, and especially with Parkinson's and with the constipation problems.
Constipation, yeah.
Absolutely. I think that it is important for you to have probiotics.
All right, thank you. Thank you.
So
Okay.
ask.
Janie P, did you have your hand up? Did you have a
Yeah, I
question?
just have something. Can you hear me?
Yes.
You can. Okay, I wanted to share what my surgeon said to me when I was looking at a hip replacement. He said people with PD should never go under general anesthetic, if possible, and to rather use a spinal method for anesthesia. He said the general anesthesia makes the PD worse. So
Yeah.
I just wanted to share that. I didn't know that.
That's a very good share, and I can understand why he said that to you. And so, but that's something that you should definitely discuss with your doctor. Actually, you can discuss all of these things with your doctor before the need arises.
Right, exactly.
For sure, before you travel, you should know whether you should be put under anesthesia at all, in the event of an emergency. You should know, like I said, you should have the list of what you cannot take so that if you are hospitalized, they see it right away. Should not be taking these medications because they interact with the medications that I'm on.
Okay. That's a good
All right.
point. Okay. Thank you.
It's very good to know these things for sure.